Good morning. I just want to welcome you to our community briefing. This is an opportunity for me as your sheriff to bring to your attention items I believe are of interest to you that are impacting the community, and it's designed to make you aware of some things that are happening within not only the county but the state and beyond. This is my third year. I've just started as your sheriff. I'm more than halfway through my term. We've had a very challenging last year for several reasons. We had the COVID pandemic that was addressing our community, the state, and the nation, and Orange County was not exempt from that. And also civil unrest that took place from May until the end of the year. We had over 60 events in which the Sheriff's Department responded to in areas that are Sheriff's jurisdiction and helping our municipal partners in other areas throughout the county. We're looking forward to turning the corner in 2021 and hoping this is a great year for all of you as well. First, I want to talk about several issues that have happened throughout the country, specifically in Atlanta with the shooting that occurred there, or shootings, and this week in Boulder, Colorado with an additional shooting that took place and many lives lost. These are the result of bad actors that are determined to harm the communities in which they live. Regardless of the motivation, it is intent on hurting people. In Orange County, we have a fusion center as part of the fusion center network throughout the nation. There are 80 fusion centers across the country, and Orange County is the only county in California that has its own fusion center. I'm very proud of the outcomes they've had over the last several years. In fact, our fusion center in Orange County is the second highest producing fusion center in the nation, only behind New York City. And that takes a very concerted effort on their part. My condolences to the family members and the communities who have been impacted both in these incidents across our country, and we will do our best always to protect Orange County residents from those types of risks here. Today I'm going to talk about 4 topics that are of interest to you, I believe. One is the increase of fentanyl within our community and what we're doing locally and within the state to try to curb that through enforcement and legislation. Also, I want to cover our newly formed Behavioral Health Bureau. This is a manifestation of our previous efforts through homeless outreach, and I believe the right direction for us to take both in our jails and within the communities we patrol. I'll give you a brief update on COVID-19 as it's impacted our jails, and also ways in which our department has interacted with the community in an ongoing effort to provide services. First, let me talk briefly about fentanyl. As you're aware, or you may not be aware, fentanyl is an opioid synthetic. It's manufactured south of the border in China and then trafficked into the communities from abroad. It is 50 times more potent than heroin, and new forms of fentanyl, known as carfentanil, is 100 times more potent than fentanyl, which is 50 times stronger than heroin. Over the last 4 years, our sheriff's narcotics teams have seized 388 pounds of pure fentanyl, which represents 88 million lethal doses. In 2016, we sponsored legislation in the state legislature that didn't progress beyond the Senate committee. In that time, we've had significant increases in fentanyl seized. In 2017, we had 4 pounds of pure fentanyl that was seized. In 2018, we had 103 pounds of pure fentanyl. In 2019, we had 207 pounds of pure fentanyl. And last year, mostly because of COVID-19, we saw trafficking of fentanyl decrease, which is a good thing, but now we're seeing it start to increase again in 2021. The best thing we can do about that COVID caused, if there was one thing, was an interrupted drug trafficking efforts into the community. Regardless of those efforts, though, from 2016 to 2020, we have seen an increase, a significant increase in fentanyl-related deaths. I want you to notice that I call them fentanyl-related deaths and not overdoses, because many times people who are using fentanyl or using our narcotics are unknowingly using fentanyl-laced narcotics. In 2016, we had 37 fentanyl-related deaths. In 2020, we had 345 fentanyl-related deaths. And that's not including the 200 pending autopsies and toxicology for deaths that occurred that may also be fentanyl-related. Fentanyl deaths are not only happening in Orange County. The California Department of Health have reported that there were 104 fentanyl-related deaths in 2014, and it increased to 1,603 in 2019. Initial data for 2020 shows fentanyl-related deaths thus far at a staggering 1,550. This does not include a program we put in place in 2017, which is the naloxone program. Our Orange County Crime Lab was the first lab west of the Mississippi to see fentanyl in our community. In response to that, I implemented a program for naloxone. Naloxone is an opioid antagonist. It stops and interrupts how opioids are impacting the central nervous system. And I'm proud to report, as a result of that program, when it started, we had 20 saves in our community. Unfortunately, because of the prolific increase in fentanyl, in 2020 we had 93 deployments, 61 in the community, and 32 in our jails, which also experienced drug trafficking issues. Thus far in 2021, we have 21 deployments, 13 in the community, and 8 within our jail. And this is what's important about when we look at fentanyl-related deaths. These are deaths that would have been reported if not for our naloxone program. To date, we've saved more than 200 lives with our naloxone program by intervening early, responding early with this program. For the 6th year, we're sponsoring legislation being carried by Senator Pat Bates, Senate Bill 75, and also for the first time this year being carried by Assemblywoman Connie Petrie Norris, Assembly Bill 1351, which closes a loophole in the law that now would include, if passed, fentanyl for sales and distribution as an enhancement penalty in the same way that heroin, cocaine, and methamphetamine is also included. It's necessary to include this legislation because currently drug traffickers trafficking pure fentanyl, which is much more dangerous, much more lethal than cocaine, heroin, or methamphetamine, is excluded from the law, and encouraging drug traffickers to traffic pure fentanyl so they will not be held accountable for the enhancements that are included in the other sections of the law. I'm proud of our efforts in working with Senator Pat Bates and Assemblywoman Connie Petrie Norris on these efforts to change the law and hold drug dealers accountable. What's most heartbreaking are some of the stories I've heard from members of our community. Many families have lost children to the efforts that have taken place by drug dealers to saturate our communities with fentanyl. What's reported to me by families who are impacted, that 3 out of 4 parents find their children deceased in their bedroom the following morning by using illicitly produced fentanyl-laced drugs. One of those parents is a local Orange County resident named Amy. We're going to highlight her story in a video that we posted on our website, ocsheriff.gov, highlighting Amy's tragic story, the loss of her son. I encourage you to watch it and share it with anyone who has a teenage son or daughter. Many of these children died after ordering pills off social media sites like Snapchat. It's oftentimes referred to in the community as drug hub. They contact people, drug dealers through social media, who deliver illicitly produced narcotics to their front door. And this is what is most tragic about this. Although any illicit drug use is bad, the people buying these pills think they're buying either OxyContin or oxycodone, and they're not pharmaceutical produced drugs. They're not made by pharmacies. They're being clandestine produced south of the border, delivered or smuggled into California, and sold as pills that they are not. They are oftentimes laced with fentanyl as the intoxicating substance, and oftentimes causing fentanyl-related deaths of young adults and our children. Please share this story with others. Please make them aware of the risk, and please get involved with your children to make sure they're not using these narcotics or testing drugs in some recreational form. Next, I want to cover our Behavioral Health Bureau. This is part of the county's integrated services plan that was put into place, involvement with the Sheriff's Department, and it significantly improved the way we're dealing with the community in which we interact. I've said this before, and I do mean this. Law enforcement should not be the first face of government that those experiencing crisis should know. They should not be interacting for the first time with somebody wearing a uniform and a gun. We need to increase our services with the right intervention strategies, social service strategies that replace a law enforcement response. We should not be the lead role. This is a multidiscipline approach using key stakeholders within the community, including mental health, clinicians, and other providers to help us with this problem. It's also a progression of our homeless liaison officer program. We've had to date 50 different homeless liaison officers who work within the community, and we're transitioning to a behavioral health bureau model. This is necessary because when we're dealing with the homeless, we've realized that many of these people are experiencing mental illness and also substance use disorder. And transitioning away from homeless outreach specifically allows us to intervene with people before they're homeless or people who are housed experiencing crisis by bringing the appropriate key stakeholders and interventionists, social workers, and clinicians to deal with those issues in lieu of a law enforcement response. I'm proud to be working with many of my community chiefs of police in this endeavor to come up with one holistic solution countywide on how we address these issues before they become criminal violations of law or require the interaction with law enforcement or introducing them into the criminal justice system. We currently have two forms of behavioral health. One is based in the community, and we have another one based within our jails who are delivering the same services within those entrusted to our care. 8 personnel, though, within the community are permanently assigned to the Behavioral Health Bureau, and we have more than 50 homeless liaison officers that will be transitioning to behavioral health liaison officers to work in this effort to bring an end to those experiencing crisis. We are working collaboratively with the healthcare agency, mental health professionals, and other key stakeholders, and the goal is to increase crisis intervention services and develop and utilize innovative methods to reduce recidivism and help people connect to services in lieu of entering into the criminal justice system. Most importantly, our behavioral health liaisons will be trained at a very high level. Currently, every deputy in the Orange County Sheriff's Department receives 8 hours of crisis intervention training. Our homeless liaison officers, now behavioral health liaison officers, will receive 80 hours of training. 40 hours in crisis intervention, which is known as CIT 1, 2, and 3, and additional 40 hours in other areas to help them become experts in addressing these issues. But they are not the only experts. They're augmented with other clinicians, mental health workers that help intervene appropriately so we can get out of the business of dealing with those in mental health crisis, substance use disorder, and those who are experiencing homelessness. You can learn more about our Behavioral Health Bureau on our website, www.ocsheriff.gov, under highlights about the Behavioral Health Bureau program. To bring you up to date regarding our COVID-19 impacts, we had a lead role at the Emergency Operations Center. That is the role of the sheriff. Our Emergency Operations Center has been active since March of last year. Over 1 year, we have had an active response in addressing COVID-19 within the county as a whole, within our communities, and specifically within the jails. And most importantly, what we've been able to accomplish are protocols that have been in place since March, bringing our staff and our community into a safe environment of interaction, and especially within our jails. COVID within our jail is still an issue. We've had success in addressing these cases and keeping our inmates safe and dangerous offenders still behind bars. To date, we've had 2,314 total cases of COVID within our jails. We've also had 2,833 negative results of people tested for COVID within our jails. These protocols have been put in place early on after we had the ability to test within the community. We started testing immediately within the jails. And these protocols have remained in place since March of last year to date, and they will remain in place until we fully mitigate the risk of COVID within our community and within our jails specifically. To date, we have 2 inmates who are positive with COVID-19 housed in the Orange County jail system with approximately several thousand inmates. At a height of 1,240 at the end of December, down to 2 today. Since the outset of the pandemic, ACLU has pursued litigation to release inmates entrusted to our care. Orange County Superior Court issued an order in December of 2020, a member of the court, that I should have said, that if implemented, would result in the release of 1,000 inmates entrusted to my care. I've opposed all efforts to release these inmates, and I will continue to oppose those efforts through legal processes to help prevent the release of these inmates back into the community, because I believe they present a significant risk if released back in the community. What we have, though, is we've always had a plan. Since March of last year and every month since then, we've had screening for those entering the jail, including personnel. We've had PPE available for staff and inmates. We've increased hygiene and cleaning supplies to inmates in areas that they convene. We suspended visiting and programs to prevent those from entering the facility. It might create unnecessary risk. and we've implemented several layers of quarantine and housing protocols to mitigate the spread of COVID-19. To date, I have released more than 1,700 low-level offenders who I believe I could release to create capacity necessary to safely house those entrusted to our care. And I believe those protocols, all of those protocols have helped us navigate our way through COVID-19 with successful resolutions in our jails in Orange County. Currently, or recently, CDC has expanded their criteria and qualifications for those who can receive the vaccine. And those criteria now include those incarcerated in correctional facilities. We're working with Correctional Health Service to provide the vaccine to any inmate entrusted to our care who wants and is willing to take a vaccine. Every inmate will be offered a vaccine if they want one. Additionally, staff as first responders assigned to the jails, that includes deputies, medical personnel, and others, are also available to have a vaccine, and it's offered to them as well. I cannot mandate those to take a vaccine, but we can offer and will continue to offer both our staff and those incarcerated a vaccine if they want one and are willing to take it. I'm also happy to report that we are going to reopen public visiting within our jails. Our visiting has been closed for more than a year. I want to thank specifically our staff and those who are trusted to our care, the inmates, for their patience and understanding and helping us navigate our way through this. And for that reason, we're going to open cautiously on a scaled basis our inmate visiting. And we're going to do that responsibly by looking out for the safety of our staff, for those visitors, and also the inmates, so we can make sure that we do so responsibly and make sure we curb any resurgence of COVID-19. That will begin this Friday, May 26th. Initially, inmates will be limited to one visit per month, and we'll expand out as that increases. And most importantly, if the inmates who are willing to get vaccinated can continue the vaccination efforts, we can then scale up our visiting efforts as we go forward. You can learn more about our visiting that we'll release later today on our website, www.ocsheriff.gov, for information about our visiting protocols that we put back in place. All that said, we are turning a corner in COVID-19 within the community and also within our jails and as a nation. But this is by design and deliberate actions of those who are acting responsibly. I want to encourage everyone to continue wearing a face covering, to wash their hands frequently, and to socially distance when necessary so we can continue the positive outcomes we've all had in addressing COVID-19. It is these collective efforts that will keep us going the right direction and get us opened back up quicker, sooner than we would if we have a resurgence within the community or within our jails as a result of a resurgence within the community. Please, please practice all the protocols that are recommended so we can safely reopen and get back to normal. Lastly, and quickly, I'm going to cover some of our community outreach efforts. We actively collaborate with diverse community groups and leaders, and this is to ensure that we have open and honest dialogue, fostering an environment of mutual respect and understanding. One program I'm most proud of is the Sheriff's Interfaith Advisory Council, comprised of more than 60 faith and community leaders. And this includes many of the diverse faith traditions here in Orange County, including Muslims, the Sikhs, Catholics, the Jewish community, and the Christian community, and many others. And what this has enabled us over years is to create a dialogue of mutual understanding and trust. What I love most about this group is how we've transitioned into Orange County to have one united front against hate and hate incidents. When you see things happening like what happened in Poway last year or 2 years ago, it wasn't just the Muslim community, it wasn't just the Jewish community standing up against that act. It was a collective efforts of all faith traditions in Orange County standing up against hate and hate acts. Any act of hate in the community or in the nation is something we cannot tolerate. So we stand united against hate incidents here in Orange County, and we work collaboratively to educate the public on ways to help keep themselves safe and how to report hate incidents and curb hate-based acts from occurring here in Orange County. I'm also very proud of some of the seminars we put on for the faith community to help them be safe within their community, conducted by our Orange County Intelligence Assessment Center. And that's done to make sure that they have protocols in place and see signs of somebody acting in a bizarre or strange manner that they can bring to the attention of law enforcement, help mitigate the risk of those who might be unnecessarily targeting one of their places of worship. And this fall, I'm proud to announce that part of our interfaith collaboration, we'll be having a half-day event addressing mental health crisis with faith leaders within the community and helping them as an outreach effort to address mental health issues within their congregations and within the community. We've also developed several community councils that I'm most proud of. I have a Latino community council, we have a Black community council, and I have an LGBTQ community engagement that I work with here in Orange County. That's very important because these groups and many others that are faith-based are oftentimes targeted for hate-based incidents. Through this collaboration, we can help develop mutual understanding and trust and work towards the common goal of ending hate and having an environment where everybody can feel safe, whether in place of worship, in their schools, or in the community as a whole. One other outreach effort I want to highlight is the 6 Points for Kids program. This is a volunteer, employee-driven program. It's ways for our staff, both sworn and professional staff, to connect with the community outside of a call for service. They're finding creative ways to identify an immediate positive impact in the community. This program was conceived by our line-level deputies in 2015 and brought forth with an effort to interact in a positive way with members of our community. To date, more than 300 employees have participated in the 6 Points for Kids program. During this pandemic, they've even found ways to connect with families with critically ill children, families who are experiencing domestic violence situations, emancipated youth, CHOC hospital patients, and also children at emergency shelters. I'm very proud of their efforts and their ongoing desire to serve the communities in which they proudly serve. In closing, our deputies in 2020 had more than 309,000 calls for service and serving the community from the Sheriff's Department. 2020 was a very challenging and trying year due to the pandemic. I know we're turning a corner, and I'm looking forward to serving your community, and our deputies are very proud to be your service provider in the communities we serve, in the 13 contract cities and the unincorporated areas. In addition to the airport, John Wayne Airport, the harbors, OCTA, and the many other ways we have the opportunity to outreach and engage with the communities we serve. Thank you for your time. I'm looking forward to serving as your sheriff in the next year, and any way we can help our community, please let us know. Thank you.